Now let's talk about burns on page 19 of the textbook. We're going to talk about 3 types of burns: first, second, and third degree burns. First degree burns affect the first layer of skin. Second degree burns affect the first and second layer of skin. And third degree burns affect all 3 layers of skin. So let's talk about first degree burns. The skin is red, it's hot, and it's painful. And so for our treatment, we want to remove the heat source. Let's say that the infant had hot coffee spilled on them and their clothing. You're going to want to remove the heat source. You're going to want to remove the hot, soaked clothing. And so remove the clothing around the burn area, and then we want to immediately cool the area with flowing water for 5 minutes. Watch for shivering though. Don't pour so much cold water on the infant that the infant begins to shiver. If you see that, you need to back off a little bit on the cold water, and you want to wrap the patient up a little bit to warm them up. You want to pat that skin dry, and then you want to loosely cover that area with a non-stick sterile bandage or gauze to protect the skin. You want to contact your doctor for recommendations on applying aloe or other topical ointments. And then as a pain reliever, you want to follow your doctor's directions. Second degree burns, signs and symptoms, going to be red, hot, and tender. There's going to be swelling. And in second degree burns, there's going to be blisters. Once again, the treatment is remove the heat source, remove the clothing around the burn area, and then immediately cool the burn area for at least 5 minutes with cool flowing water. Watch for shivering, pat the skin dry. This is a blister we don't want to pop, so leave the blister intact, call the doctor. And if this is a large burn area, this is a burn area that is larger than the palm of your baby's hand, then you need to call 911. And once again, if you're concerned in any way, call 911. Third degree burns, signs are going to be charred skin if it's caused by a flame, or it's going to be white if it's caused by a really hot liquid. So really hot liquid, the skin is going to look like steamed chicken. Treatment, we're going to remove the heat source, remove area clothing. However, if clothing is sticking to the burn, don't remove the clothing that is sticking to the burn. Lay the infant flat. Immediately cool the area with cool flowing water for at least 5 minutes. Watch for shivering and call 911 immediately. Now let's talk about chemical burns. There's 2 types. There is liquid and there are dry chemicals. And so for a dry chemical, what we want to do is we want to take a gloved hand, or we want to take a cloth, and we want to brush away the chemical. Brush away this dry chemical and then wash the area with cool flowing water for 15 minutes. And we're going to treat this just like we would treat a first, second, or third degree burn. If it's a wet chemical, we're going to wash the chemical away with cool flowing water for 15 minutes, and we'll treat it as a first, second, or third degree burn.